Good morning, dear colleagues from CIRSE. I am Pepe Urbano, vascular and interventional radiologist in Madrid, in Ramón y Cajal Hospital. I try to show my tips and tricks to take the history of the patient, of our patient. The title of this micro video is How Do I Take Patient History for IR? First thing is to review the patient before the consultation. So we review the patient history and we review the images. And of course, it's important to know why is the patient consulting to us. How do I take patient history for IR? First of all, we have to have a facility. It's important to have a waiting room clearly identified with IR clinic. The medical office, of course, as any medical office, have to be quiet, clean, well ventilated. We need a table. I prefer 3 chairs, one for the patient and two for the relatives or for the friends, a computer, and if possible, it's interesting to have a stretcher for physical examination. And sometimes would be wonderful if we have also an ultrasound. Ultrasound for us is very useful for the exploration. Sometimes what I do is to transfer the patient to the ultrasound room for get the Doppler, get the ultrasound, and also to do the physical examination. Remember that physical examination will be focused on the pathology that we are studying. Blood pressure, antebrachial index, the pulses. We have to touch the skin if there are trophic change, stitch painful, and all those things that we are looking for. How we act and how we look. This is very important also. We have to remember that many of our patients are old or are not familiar with medical terminology or medical devices. So we have to speak clearly, slowly, and loudly. If necessary, we have to repeat that the patient, if the patient has not understood or if the patient asked for it. Remember that no more than 30% of what we are saying is going to be remembered by the patient. Very important to look the patient eyes. If the patient comes with a relative, and this is very frequent, or a friend, make the patient the protagonist of the interview. Let the patient explain and avoid too much explanation from the relatives. The dress code, especially in big university hospitals or public hospital, not very elegant, not show off to the patient, and this is, in my opinion, a good thing to present to the patient. And it is also very important to transmit confidence and self-confidence during the interview. Unfortunately, especially the first time, many patients do not know what IR means. So I used to do a short introduction of myself and a short explanation of my specialty. For example, I used to say that IR is the therapeutic part of radiology, or we use the medical image to guide treatments. I always talk about treatments. Do not talk about techniques. We do treatment, not techniques. And this is important point for the patient. First, after that, during the interview, the core of the interview has 3 points: the medical history, the previous surgeries, previous illness, allergies, and current medication. We have to write down this data. The second point is the current problem. What's wrong and since when? This is the question that Hippocrates did 2000 years ago, and it's the same for every consultation. What's wrong and since when? Obtain a clear sequence of symptoms and signs, and at the end, we are going to obtain the right diagnosis, and with the right diagnosis, we can provide the best treatment. And the third thing, and probably very, very important, is to give the informed consent and to explain the informed consent, the advantages, the disadvantages of our treatment, the alternatives, the risk of and the risks of our treatment. But remember that the consultation of IR, many times we will do nothing more than clear up those and explain our treatments. Remember that many patients come with a diagnosis and only come to us just to understand what are we going to do with them. And this is very important because they they are going to understand that we are their surgeons, we are their doctors. So we look our face, we look the face of the patient, and they understand that we are the person who is going to treat them. So my personal trick is a checklist about admission, about anesthesia, and I always explain the patient what is going to happen after the treatment. Admission, remember to the patient if the admission order has been done, insist that he or she must come fasting. Regarding anesthesia, we have to check if the patient has passed the pre-anesthesia consultation. And of course, it's very, very important to check if anticoagulation drug has been discontinued. And for the patient comfortability and to give security to the patient, we will explain what is going to happen after the treatment. How long will you be on sick leave? When will you be able to return to normal life? Will I have pain, doctor? Yes or no? How can we travel? How can we have sex? All those questions are going to be solved during our consultation. And finally, how do I take patient history for IR? Remember that the IR has the duty to facilitate healthcare by completing our patient's medical history. Other specialties should be able to see our comments, treatments, and recommendation to the patient. And any information added to the history must be signed and dated. Thank you very much, and I hope that my experience could help you to get a very good history for the patient.